Okay, so I'll go ahead and get started. So today I'm going to be talking about a spatiotemporal analysis of COVID-19 tweet trends in subnational areas of the United States. We can go to the next slide. So I don't have control over the slides.
Oh, Kristen, there you go.
All right. So as background, what we know is that infection of COVID-19 with the coronavirus itself is not evenly distributed across either space or time. And for example, you see at the bottom left there a map at the county level of the contiguous United States with coronavirus infections as of 1 week ago on November 25th. And you see that rates are much higher in the rural West and Midwest compared to, for example, the coasts of the United States. So you see that it's not spatially evenly distributed. You also see at the bottom right there that looking at the temporal distribution, that there is not an even temporal distribution. There are peaks and troughs, right? And we're currently experiencing quite a peak. And so the premise behind this study was that we care about tweets because it is a proxy measure for how concerned people are with coronavirus itself, right? And that fluctuates. And that concern allows us to measure fluctuations in preventive behaviors, which in turn has an impact on rates of infection and mortality as well downstream. So the objective of this study, therefore, was to describe the spatiotemporal distribution of COVID-19 tweets in the United States as a proxy for COVID-19 concern, right? So, and I'll describe in the next slide that I'll be analyzing the distribution of space and time for these tweets in the early outbreak period concurrently, specifically between March 3rd and April 13th for that 32-day period. And so what we did was to access the tweets, to obtain tweets using the Twitter API with the keywords corona outbreak, corona, anti-corona, coronavirus, Wuhan virus, COVID, Wuhan pneumonia, and pneumonia of unknown cause, which at the time was the set of keywords that was thought to, that was agreed upon by many to be consistent with coronavirus, with tweets about coronavirus 19. And so we weren't satisfied with just looking at tweets about coronavirus 19 at all, including news sources, for example. We wanted to be a little bit more specific than that. So what we did in a separate study was we took a subset of these tweets and we manually annotated them for whether or not there was evidence of firsthand exposure to the coronavirus 19 disease, including symptoms like coughing, pneumonia, chest pains, and so forth. And I used this to train a machine learning classifier using support vector machines. And then I applied that classifier to the entire corpus of tweets collected during the 32-day period for this study. To analyze these tweets temporally, we use the C3 algorithm of the early aberration reporting system, which is the same algorithm used by the CDC for detecting outbreaks of rarer infectious diseases. And we did this at the state level. So there is a spatial component to this analysis. To look at it spatially without the influence of time, we constructed choropleth maps of COVID-19 tweets, both in totality and normalized. And then to do what I described earlier, to look at this in a spatiotemporal manner, both space and time at the same time, we constructed what's called a space-time cube, which you see at the bottom right here, and then did emerging hotspot analysis. And what you can see is that these blue dots here toward the very bottom right would be examples of tweet instances, and the vertical component there can be bins of days. In this study, we binned our time component into days, and the X and Y are space on a 2D plane, right? And so you'll see fluctuations of tweets over time, you'll see fluctuations over space, but the objective of this was to look at both space and time at once. So if we go to the results now, next slide. So these are the results of the early aberration reporting system analysis. And what we can see is that there are aberrantly high numbers of tweets around the March 29th weekend, and they tend to occur in states that are somewhat more rural. So examples would be Arkansas, Missouri, Montana. Go to the next slide. So here we see the distribution of total tweets in a choropleth map. At the top, map A, and we see that they are from where you would expect, where there are a high number of people. And at the bottom right, we see the normalized, adjusted to county level population, and we see a much more even distribution. So looking at this, looking at the distribution over space alone doesn't tell us too much. We go to the next slide. So this is looking at them both together, and these are in 2,500 square kilometer intervals. And what's done here, the technical details is that a G-score, G-score was calculated, Z-scores of that were calculated, the Mann-Kendall test was performed, and a Z-score of that test was mapped here for each 2,500 square kilometer interval. The top map shows the increasing and decreasing trends overall for the tweets, and the bottom shows these normalized. And what you can see is that there is an increasing trend in the Deep South and states that are a bit more rural, like Wisconsin and Minnesota. Next slide. So this is my final slide. So we uncovered about 175 million tweets, but less than 1% of them had geospatial information. Only about half of them were from the United States, and a low proportion of those were chosen by the machine learning SVM classifier. So an analysis like this can really only be done in a circumstance where you have a massive number of tweets, such as the early outbreak period in the United States for the coronavirus pandemic. A longitudinal analysis uncovered a relative spike about 3 weeks into that early outbreak period on March 29th, and normalized space-time cubes suggested that we had an increasing amount, increasing engagement with this topic in Deep South and rural areas of the United States. And this is important and has public health significance because it allows us to detect responsiveness to emerging public health threats. And that will in turn allow interventions to be targeted toward those communities. And that's all I've got. I'd like to thank my collaborators and funder.
Thank you, Raphael. Let's see, in terms of questions. Okay, I can't see many, but I will probably start, and then we'll probably have a few more questions. First, I was thinking, is it possible to integrate state-specific policies and with messaging, Twitter messaging, and did you attempt that in other research?
Sure, yeah, certainly. It's possible. So states do have their own policies regarding the quarantines, and state-specific resources. I think that social media campaigns can be integrated into this, but regardless of whether or not you use social media for an intervention component, I think that surveillance with social media should be an integral part of understanding community-level variations in responsiveness to infectious disease pandemics.
Absolutely. My question was, could you expect to observe some variation in Twitter behavior, given what was the policy in the particular states?
Yes, so I think that if we were to categorize states, for example, by their policies and then determine and to assess whether or not there are differences according to states depending upon their policy, I think that's something that could and should be done. I think that's been done in the past for other topics. I don't know if that's been done for COVID in particular, but I think that that's a reasonable study to pursue.
Right, and just a final question. Have you tried to assess all concern now and develop hypotheses on where spikes might happen in the future?
Yes. Yes. So. Yeah. Right. So there is a separate study that we have pursued that has tried to model infectious disease rates of COVID using different time lags of Twitter mentions. And so we're seeing, interestingly, that in the early outbreak period that there is some prediction on a 2-week lag of areas where there are high numbers of tweets and then subsequent high rates of infection. So it's hard to say right now whether or not that's specific to an early outbreak period, or whether or not that would be, something that would allow us to predict in later outbreak periods as well. Although I should note, this is likely not the last pandemic we'll see. So in future, understanding the early outbreak period of pandemics is critically important and not irrelevant to future challenges that we're going to need to address.
Right. And there is another very interesting question, whether you correlated those rural spikes with the clinical cases or hospitalizations.
Yeah, so yes, in a separate study, we did try to do that with a time lag. So what we saw was that if we looked at the number of Twitter mentions at the same day, it wasn't quite as predictive unless you had a time lag. If you had, say, a 2-week lag, and you were to test different time lags, you're better able to find a relationship between cases and tweets.
And a final question, which is extremely interesting. Why was there a spike, and what might that mean for the states and their response? So in terms of policies based on your research, how do you see it, and how do you think that could feed into the response to the pandemic?
Right. So that's a great question. There are two separate questions though. So the first one, the reason for the spikes, I don't think that's necessarily state-specific responses. Unless you're considering the quarantine, it's possible that later stages of the quarantine in rural areas catalyzed a lot of discussion during that weekend in the last weekend of March. I think that one reason we're seeing this spike is because in areas like California, New York, we had a very high level of engagement at the very start of this study time frame, and that remained pretty high or even decreased a little bit throughout this 32-day period. Whereas there are other parts of the United States that weren't quite so interested in this topic on Twitter early on, and then suddenly you see this rise maybe as things start to get more serious. And the other question, how this might impact state policies, is that ability to target populations, knowing ahead of time how responsive your populations are going to be to these public health threats.
Thank you. Wonderful research. Yeah.